So here we want to develop an intelligent system for diagnosing heart diseases. So we have the inputs are cardiac images, clinical notes, and physician's interpretation. The output will be whether they are sick or not. So the method for diagnosing is SPECT images. The test methodology that we will inject the patient with a radioactive tracer, radioactive tracer, and we'll have two sets of SPECT images. One, it is 10 to 15 minutes after the injection with like them moving and doing exercises, so stress image, and 1 2 to 5 hours after the injection. So then they will look at the two images and compare between them. The data that was used, we have 267 cardiac diagnosis cases, two SPECT images, 44 divided by 2, we have 222 regions. So we will check the region brightness, which means it will reflect the region and we'll get a number between 0 and 100 for the diagnosis. So as we can see here, we had two outputs. We have for the first output and the second output, but through the, of course that we have to know that we use sigmoid function, okay? The training set, when we did the testing set, we saw that the performance is really poor. We had 25% of normal cardiac diagnosis cases was misclassified as abnormal, and 35 abnormal were classified as normal. So this is a problem, especially for the people that were sick and were classified that they are not sick. So to improve the performance, we use the fuzzy system. So for example, here we say the normal output is 0.92, the abnormal is 0.16. In the SPECT image are classified normal, okay? So we couldn't, that the risk of heart attack for this case is low, and the opposite for the high, and so on. So how the the fuzzy logic can help? It was used to improve for the abnormal cases. So we will determine an input and output variables, define a fuzzy set, and construct a fuzzy values. We have inputs in neural network 1 and neural network 2 from it, 0 and 1, and the output will be the risk of the heart attack 0 to 100%. So we have, this is for the first output, this is for the second output, okay? So we set some rules and the decision became as followed. So if the risk is low, it says smaller than 30%. If the risk is high, greater than 50%, and so on. So the new result came back that the overall diagnosis error does not exceed 5%. So 3% were abnormal, classified normal, 30% normal, classified abnormal, and 20% total cases that were classified as uncertain. So we can see that the neurofuzzy system are actually achieve better result in classifying the SPECT image than the cardiologist can. So the abnormal SPECT images now can be recognized with much greater accuracy. So we can see we have the combination of both. We can do the Mamdani method. If we have OR, we use the max, and if we have AND, we use the minimum. Same as we explained before. We will get the crisp value just like this. Then we will use the center of gravity.